Okay, so this is a full exam question. They said, briefly discuss diarrhea disease under the following headings. You should talk about the presenting complaint. What will the patient likely complain to you? Okay, that they are suffering. What is that sufferness? Okay, then that you should also talk about the signs of dehydration. You should talk about investigation. You should talk about complication. So here you are asked to discuss diarrhea disease, but not general. They gave you areas of focus which you must hit them. Then as a student, if you have time, you can still add one or two like treatment and all of that. But you do that only when you have time. So for diarrhea disease, we'll go straight up to what they asked us to discuss for diarrhea disease. Now for the presenting complaints, patient will tell you that, doctor, I'm passing stools frequently. Okay, then they also tell you that the stools are loose, they are watery. Okay, then you ask approximately how many times they stool in a day. So if it is equal to 3 times or more than 3 times, then of course you are suspecting diarrhea disease. So it may be associated with fever, abdominal pain, vomiting, and poor appetite. That one is like secondary presenting complaints. The first thing they always tell you is that frequent passing of stools, okay, and it's loose and watery. So in infants and young children, you should also be expecting things like irritability. The baby doesn't even want you to come near it. You know, the baby is refusing to feed. The baby is crying so much. You know, that sometimes they are passing mucus in feces or also blood in feces. So the next question they ask you to discuss under diarrhea is, what are the signs of dehydration? Because there's dehydration in diarrhea. The baby is passing out so much stool, and this is reducing what? The fluid levels of the body, leading to diarrhea. So general appearance, the person is restless, irritable, lethargic. Okay, eyes are sunken. I'm coming. Eyes are sunken. All right. The mouth and tongue is dry. Okay. Skin toggle. There's poor skin pinch. There's low return. Then test. The person is eager to drink water because they are dehydrated. Urine output is reduced because they are dehydrated, of course. Then sometimes they have weak pulse. If you touch their extremities, that's the hands and legs, it's cold. Okay, altered consciousness, that's when it's actually getting so severe. All right, so investigations, most cases are clinically. I'm coming. So most cases are diagnosed clinically. So from all the signs of dehydration or the signs and symptoms generally of diarrhea disease, you should be able to diagnose diarrhea. Okay, but you might actually want to do stool microscopy, cultural sensitivity. This is because you want to identify the microorganism that is possibly causing these issues. If you do the microorganism, it will help you to now know the right drug to what use. Okay, there's stool antigen test. You want to dictate rotavirus, which is a common cause, adenovirus. You also do blood tests like electrolyte, urea, and creatinine to assess for the dehydration. You do complete blood count, to check out what infections and anemia. Okay, then you also do urinalysis just to check out for what hydration status. Okay, sorry, I'm replying people. Okay, so those are the investigations. So what are the complications of diarrhea disease? If not properly managed, it could actually lead towards dehydration and hypovolemic shock, electrolyte imbalance, where you're having all those hyponatremia, hypokalemia. It could lead to malnutrition in children. Then it could lead to growth failure, okay, failure to thrive, right? Then secondary infections, because it could actually make your immune system weak, okay. Then sometimes, if the case is so severe, it could actually lead to death, okay. That's it for diarrhea disease.